And that's the problem. This is the problem with so much of our federal agency support from federally supported housing, and you saw in this morning's paper the ridiculous state of housing in Fort Wayne. A lot of medical issues, a lot of government programs for veterans. You have to go initiate them. We don't do them automatically. You're not enrolled automatically in the system. That's the problem with children. So that even with all of these systems in all of the states, and most states have some version of CHIP, we're still not reaching even half of the 30%. And we're doing none of that in any kind of rational planning that brings them in from the time they're born. And I don't think many doctors will argue that those first 3 years are the truly critical years. And you're not enrolled in CHIP when you're born. You see, this is the kind of, well, we'll present a program and it's up to you to enroll in it, so we solve the problem. But it's barely attached, and it doesn't address the cost issue or the provision of services to folks who need it directly first. It is strictly a reactive supply answer, more a Band-Aid than a medical response to the issue. Better than nothing? Absolutely. Better than the next 25 things? Not even close. There's almost anything we could do would be better than CHIP. Almost anything we could do would be better and probably just as cheap. Questions? More?
I think the number of doctors per capita is only half. So we're not turning out enough, graduating enough doctors maybe. If we have more supply, then the price would go down. Maybe.
There has been lately, and this is a big turnaround. 40 years ago, this wasn't a problem at all in America. There's been a big decrease in doctors and nurses.
Yeah.
I mentioned earlier, part of this is the Greek thing. Part of it is the system. In the 60s, the medical establishment began to make it more difficult to become a doctor. It's really hard. This is one of those really tough issues. I remember a wonderful poem about a guy by Rick Maston who says, you know, I don't need everybody to graduate from college, but I hope the guy who's flying the plane I'm getting on has. And we want good medical education, but we don't provide reasonable cost, effective education to our doctors and nurses. We provide extremely high cost education to our doctors and nurses, and that is a filter that limits the number of people who enroll and who graduate. Certainly, you know, it's funny living in the least taxed major industrial Western nation. Healthcare is one of the things we give up for that. But when I went to Canada, now it's a couple of $1,000s now. When I went to Canada, it cost me $400 to enroll in the premier educational institution in the entire nation, University of Toronto. McGill is roughly its equivalent. McGill was a little bit more than that, but not much. $400 the basic cost of any student going to college in Canada. $400 a year. And even an American who could get in paid $400. Everything else was paid by the government. They had very strict entrance requirements. Not any fool could get in. But if you could get in, it didn't cost you anything. Admission to university was an intellectual requirement, not a financial requirement. There were other universities with lower intellectual requirements, and there was a vast, elaborate network of technical schools, which they call collegiates, that could train you for the equivalent of Indiana Tech or Ivy Tech. Those schools, basically, if you could qualify for those schools, they didn't cost anything, $25 or something to take a course there, and you could get paid for the time you had to take off work to go. So you ended up making money going to school there, rather than costing you money. But you came out better educated and were a contribution to the national economy. That system we don't have. And we don't have it not because we have less money than Canada, but because we have different priorities.
Was the turnout rate better or higher? You know,
The graduation rate is much higher
in Canada.
in Canada. The number of people who go to a full four-year university is about half that of America. My figures are maybe 20 years out of date, but I suspect there hasn't been that big a change. It's not any easier to get into the University of Toronto now. About half the people in Canada get university four-year degrees as in the U.S., but more people get technical degrees and technical training. Nurses is a technical, you don't have, most nurses in Canada have a 2-year technical degree with a year specialization if you want. If you're a nurse practitioner, you have to go 4 years. But here, an RN is 4 years. A nurse practitioner is another year on top of that, plus what, 3 years experience or something like that? What? Yeah, it's some elaborate. But so that's the difference is there are many more things you can do with a 2-year or a 2-year plus specialization degree that here would normally expect a university degree. The other thing is there aren't very many university degree people working at McDonald's in Canada, and there are here. So they...
Yeah, I just want to comment that I think it's difficult for most of us who see that the system is broken, that it's really not a system at all. I think it's difficult for us to have much hope, realizing that the hope for any kind of change lies in the hands of 535 people in Congress and the person in the White House, and all of the power and influence that lobbyists have to bear on these so-called representatives of the American people. It really doesn't bode well, I think, for any kind of, in my opinion, for any kind of creative, positive change. What do you have to say about that?
Well, a part of me says, that's pretty obvious.
What?
That's pretty obvious. You'd be missing several years in the old transmission of life if you thought that Congress was taking responsibility for the American people. That's clearly not so.
I often state the obvious, by the way.
Well, and most people are sort of poleaxed when the obvious hits them because they weren't paying attention. And that's part of the problem, is we're not paying attention. I think the system is the best system out there. We just aren't using it. Our political system is as good as any system anywhere else.
Well, some people claim the parliamentary system would be better than...
Well, and there's a lot to be said for the parliamentary system, but but Margaret Thatcher proved that wasn't such a great system either. And the reality is, as long as people are running the system, there's no perfect system, because people can screw up any system that ever been invented. The thing is partly is paying attention. It's noting the obvious. It's not allowing us to be distracted from the obvious. I'm naturally optimistic. I'm not, I like to say, I'm not idealistic, but I am optimistic. I'm just kind of wounded optimist. I found that optimism isn't enough, and that sometimes you got to get pretty angry, and sometimes you got to get in and knock a few heads to get what you want. And I think we're in that, that's what I meant about, we need to get angry about the healthcare system, and we need to get angry about the salaries of executives. We need to get angry about the funding of college. We need to get angry about healthcare and benefits for veterans. There's a fairly long list. We need to get angry about an energy policy. The country has been fat and happy, and it's getting fatter, but it's not getting happier. And at some point, we're going to have to make that transition. And I think that's a big challenge for us.